Hi, I'm Adele from Sove CPAP Clinic. If you've ever come down with a cold or the flu while using CPAP therapy, you know it can be, well, uncomfortable. Between the congestion, scratchy throat and runny nose, putting on a CPAP mask might be the last thing you feel like doing. This time of year, one of the most common questions we get asked is, should I use my CPAP when I'm sick? The answer is that it depends. When you're sick, quality sleep is more important than ever. It's what gives your body the rest it needs to recharge and fight off illness. And if you've got sleep apnea, CPAP is what helps keep your breathing steady so you can rest properly. That's why in most cases, we will always recommend continuing with CPAP even if you're feeling under the weather. But we get it. Using CPAP when you're congested isn't easy. It can feel like the pressure is too much or like the air has nowhere to go because your nose is completely blocked. This happens because when you have a cold or flu, your nasal passages swell and produce more mucus. That inflammation narrows your airways, making it harder for the air from your machine to move through, especially if you're using a nasal mask. This is where your mask choice becomes really important. If you're normally a nasal mask or nasal pillows user and you can't breathe through your nose, you're not going to get the full benefit of your CPAP therapy. Switching to a full face mask when you have congestion can help. These masks cover both your nose and mouth, so if one is blocked, you can still breathe through the other. That way you stay on therapy and you stay asleep. Now let's talk about the air itself. When you're sick, your airways are already sensitive, and breathing in cold, dry air can make things worse. CPAP machines with heated humidifiers and heated tubes warm and moisten the air you breathe, making it feel gentler, more soothing, and far more comfortable. When sick, consider increasing the humidity and temperature a little, as moist air is easier to breathe if your nose and throat are dry or irritated. That added humidity can also help reduce nasal dryness, calm down inflamed sinuses, and even relieve a bit of congestion. It's also really important to keep your CPAP equipment extra clean when you're sick. Washing your mask, tubing, and humidifier chamber daily will help prevent germs from building up and to keep your gear hygienic. Now, just before you go to bed, it also helps to open up your nasal passages. A saline spray, nasal decongestant, or even a warm shower can do wonders. Another small adjustment that can make a big difference is to elevate your head while you sleep. Sleeping with your head raised helps reduce pressure in the sinuses and allows mucus to drain more easily. Now, what if you're feeling really unwell? For example, you're coughing a lot, nauseous or vomiting, and you just can't tolerate your CPAP for a night or two? Look, it's okay to take a short break. If your nose is completely blocked and you're uncomfortable, missing a night or two won't be the end of the world. That said, we always tell patients not to stop for too long, as consistent nights off can lead to disrupted sleep, grogginess, and a return of sleep apnea symptoms. If you are considering taking a longer break from CPAP, we advise you to go and speak to your doctor first. At the end of the day, CPAP therapy is here to help you sleep, and when you're sick, that matters more than ever. With a few adjustments, most people find they can keep using their CPAP machine comfortably. And doing so often means bouncing back faster and sleeping more soundly through it all. At Sove CPAP Clinic, we know how disruptive it can be when a cold or flu gets in the way of your therapy. That's why we're here to help, not just with equipment, but with personalized and expert care. If you ever need sleep or CPAP advice, feel free to drop by one of our clinics and speak with our team. You can also give us a call on 1300 76 2939 and we'll talk you through the best ways to stay on track. And if you need more tailored advice, we can connect you with one of our sleep and respiratory physicians for expert support. Don't forget to like and subscribe to our channel for more helpful CPAP advice and tips for quality sleep. Thanks for watching.